you to come here. Bye, baby. Diyan ka lang, ha? Love you.
Yeah. Sarap.
No more. I want more. Mama. No, stay there. Stay there, anak. Stay there.
this? Yeah, yeah. 25, my dear. Yeah, because the shipping is expensive right now. Before a little bit cheaper, but now I'm spending much money. We charge, we charge for delivery. You know that, right? Do you want it? I have a Winnipeg Jets too, and then the Toronto Maples. Yeah, Maple Leaf. So I am wrong. Yeah, Winnipeg Jets. I have lots. I have like characters like Naruto. Lots of designs. It's 25, my dear. And I have lots of rosaries here. It's a very nice. It's a wall it's a wall rosary. I will send you the picture. It's very nice. Lots of people are buying, even out of Winnipeg. I'm I have the wall rosary. It's a luminous rosary. It's a glow in the dark. Yeah. No, it's just like it's a wall rosary. It's a big one. It's a big one. It's a wall. It's a for the wall. It's $25. It's a very nice one, and there's a box. It's a very nice if you are giving it as a gift. It's so nice. I will send you the picture. Yeah, yeah, I will do it for you. You understand. You speak Tagalog. Thank you, Rob. Thank you so much. Thank you so much for appreciating my crucifix, the light one. Wow, they like it. Your mom like it. Wow. Yeah, thank you, thank you. Pardon me, sorry. I have lots. I have lots of designs here. Like I have if you need something to give like teens or for the boys or for the girls, I have lots here. I have lots of designs. Yeah, I will send you the picture. I have like it's okay. You can message me and then I will message you back. Okay, so I will send you all the merchandise I have here. Okay, okay. I'll change. I'll check it. Thank you so much, Rob. Take care. Bye bye.
Okay, welcome back. Let us take a look at our head hygiene slides. So I don't think we're going to do them all. It feels like it's too much for one day. So I'm just going to go for a bit and then kind of feel it out and see where we're at. So this is what I was talking about when this course is like, sometimes we change things up because it is a lot of content. So, big takeaway here is our 4 moments of hand hygiene, which is condensed very nicely for you in a one-page document right here. 4 moments of hand hygiene info sheet. So a lot of what I'm going to say is really packed into this one page. But we do have to go through the whole the whole rigmarole. So usually with the lab quizzes, the all of the answers are in this slideshow. Like, there's no tricks. I always take a look at the quiz for you guys and let you know what it looks like. If there is any tricks, I let you know when we talk about them beforehand. I don't want anyone, to be stressed out about these extra quizzes, because it does feel like a lot, right? So I will let you know exactly what's on the quiz, but typically everything's straight from the slides. There's no trickery. So yeah, let's get started with the slides, and then we'll see how everyone's feeling. I will stop and look at the quiz for you guys and kind of give you a snapshot of what that looks like. So this is from the WRHA. It is their hand hygiene learning module. It is also probably a little bit older, but you will be learning this like when you go practicum. You'll have to learn it again when you get a new job. So this is another thing that's going to become part of your daily life. So this presentation will take you through the who, what, where, when, why, how of hand hygiene. Some important points will be reviewed to improve your hand hygiene practice. Please view all video linked in this presentation. They contain important information. So we may do all the videos at the end. We'll just see how many there are, because sometimes I have problems with my audio. So I can set it up in a way that I don't, but it takes a little more work. So I might clump them all at the end. So by the end of this presentation, you should be able to identify who should practice hand hygiene, what it is, identify where hand hygiene practice should take place, explain why it is important, explain when hand hygiene is to be performed, how to perform hand hygiene using various methods, and describe tips for success for effective hand hygiene. So, how do we stack up? Most healthcare providers believe they're already practicing appropriate and effective hand hygiene. We're actually at about a 40%. So 40% of healthcare workers are doing their hand hygiene properly. ... Just let that sink in for a minute, right? So definitely lots of room for improvement. Now with COVID and various other respiratory things going around, we definitely have more infection control on hand. So you will sometimes have people following you, watching you wash your hands. Don't be scared, right? You're there to learn, they're there to teach. When we were at Beacon Hill, every single day we had to do a hand hygiene. Every single staff member had to do hand hygiene demo for the infection control nurse. Every day. So, again, don't be shy. Use that as your opportunity to learn. If you're wearing your gown wrong, they're going to tell you. If you're putting your gloves on wrong, they're going to tell you. That's their job. So don't take it personally. They're there to help. So 40% of us are washing our hands properly. We need some help, right? So the who, what, when, where, why, and how. So what is hand hygiene? It includes cleaning hands with soap and water or alcohol-based hand rub in order to remove germs, also known as microorganisms. So we have our two methods that we're going to talk about. Like I said, you're going to have a preferred method. The alcohol is usually readily available, and it feels like it's faster, although it's really not supposed to be faster because you're supposed to be doing the same technique from one to the other. So who should practice hand hygiene? Everybody, right? So we have to be on top of our own hand hygiene, but think about our residents. How often do they get their hands washed properly? Like, never, to be honest, right? Unless they're able to do it themselves. And even then, they probably need a little bit of help. So I worked in a facility many, many years ago. They had this crazy really high, like low level, I guess, of infections. They had this foolproof way to make sure that, you know, they were going to be the best facility and so on. So this is what they did when flu season came or any kind of outbreak started. They hired somebody to stand at the front of the dining room and do hand hygiene to every single resident. And they had almost zero spread. So paying somebody, right, 3 hours a day to come for 3 meals to wash people's hands saved them thousands and thousands and thousands of dollars, and it saved their residents from getting sick. So don't forget about your residents. Most of them want to do it. They forget. They don't know how. Maybe they have arthritis and it hurts. Help them, right? They're touching everything. They touch the handrails. They touch themselves. They go to the bathroom. They don't wash their hands. So it doesn't matter how hard we're working. If they're not doing any of it, we're kind of just battling against each other. Where? So busy healthcare providers need access to hand hygiene products where patient or patient environment contact is taking place. Hand hygiene is important in all work settings, including acute care, long-term care, community care, and corporate sites. So you have to have either a dispenser or an individual bottle provided by the place you work. They have to make sure you have access to that. Providing alcohol-based hand rub at the point of care or within arm's reach is an important system support to improve hand hygiene. So there should always be something within arm's reach. This enables healthcare providers to quickly and easily fulfill the 4 moments of hand hygiene. So they talk about points of care. So that includes the patient, the healthcare provider, and care that involves any kind of contact. Why? Because hand hygiene is the most important way to prevent the spread of germs. Hand hygiene helps keep you healthy by reducing the number of germs on your hands and helps reduce the spread of germs to your family, friends, coworkers, patients, residents, or clients. So, when I was at Misericordia with some students, one thing that they said to us, and it really stuck with me, is that, like, we can't kill all the germs. Like, we can't, right? It's impossible. But if you have 2 minutes and you're standing there, grab a Virox wipe or grab something, right? And clean the handrails, clean the doorknobs, clean something in your client's room, anything. Because you're killing the viral load that way, right? You're decreasing the viral load. So instead of 100 spores, there's now 60. Made a big difference. It's the same kind of thought process with hand hygiene, right? We may not destroy things. We can't actually on our skin. It's impossible, but we want to work as hard as we can to get the least amount possible. Using appropriate hand hygiene prevents contamination of a patient, client, or resident environment. So here are the 4 moments of hand hygiene. Now, this is the brief. This is slide 11. This is what you need to know, and then it's going to go really in depth. So this is the key slide here, okay? So before initial patient or patient environment contact, this poster you will see sometimes, like when you're in the washroom, you'll see it in your facility. This is used across the RHA, okay? Before aseptic or clean procedures, after bodily fluid exposure risks, and after patient contact or patient environment contact. So again, I'm going to break it down, but essentially, you're doing it all the time. Remember, hand hygiene prevents carrying germs into and out of the patient's environment. So, before contact with a patient or patient environment, so before shaking hands or before transferring them, those are just 2 examples. Clean your hands when entering or before touching a patient. So as you're going into the room, you're doing hand hygiene. Even if you're not doing care on them, you're coming into their environment, right? Before taking temperature, blood pressure, pulse, before making them comfortable in bed. So you're again, you might just be going in to fluff up their pillows and move their blankets around, but they've been in that bed and those sheets haven't been changed for 5 days, right? So we're coming into contact with tons of microbes. This will protect the patient from harmful organisms on your hands. So we need to protect ourselves from them, but we really need to protect them from us, right? Because we are going from place to place to place. People can kind of, like, we all live in our own germs, right? That's our body is used to that. It's when something new is introduced that it can become a problem. Sorry. So this is the same moment, right? So at the top here it says moment one, moment one, moment one. So this is all just examples of the same moment. Okay? So it's the same moment before patient or patient environment. So before you go into the room, before you touch any of their equipment, and before you touch a wheelchair or stretcher. So this is going back to the glove thing, right? So if you're doing your hand hygiene and then you push someone in their wheelchair and then you do your hand hygiene, you're good. You should be good, right? You'll be safe. Clean your hands when entering or before touching any object or furniture in the patient's environment. Same moment, right? So before home contact with their home environment. So if you're going in to do home care, so I still work home care, right? So our procedure requires us to have alcohol rubbed with us, and then we are actually supposed to perform hand hygiene in front of the client, just to ensure, just to show them that we are doing our hand. We don't have to say, hey, I'm doing hand hygiene, but it puts their mind at ease when you pull up your little bottle and you wash your hands before contact with any treatment room or clinic room. This is to protect the patient environment from harmful organisms carried on your hands. So this is now moment 2. Okay, so before any aseptic or clean procedure, whenever you're handling dressings or touching open wounds, so absolutely, right, we want to make sure our hands are as clean as possible. We're also going to be wearing gloves in this case. The only time you wouldn't be wearing gloves if you were out somewhere and it was an emergency, right? Like an emergency that happened out in public, then you may not have access to gloves. Before performing any invasive procedures, so if we're going in to do that catheter change or we're going into anything, right? Washing our hands. Clean your hands immediately before any aseptic or clean procedure to protect the patient against harmful organisms, right? We're getting up into their body and their body orifices, we need to be clean. Whenever we're dealing with cuts and abrasions and stuff like that, same thing. That's like the perfect susceptible host, right? So we don't want to be carrying anything into that. Moment 3, after bodily fluid exposure. So whether you had gloves on or not, because occasionally these body fluid exposures do occur without gloves on, right? We're going to wash our hands, of course. Contact with blood, bodily fluids, non-intact skin or mucous membranes. So you're going to take off your gloves. Every time you remove your gloves, you do hand hygiene. Never, oh, well, it's clean. You don't know what you've been exposed to. Did you do hand hygiene before? You have to do hand hygiene every time you take off your gloves. It's just standard, okay? And any contact with contaminated items. Clean your hands immediately after exposure risk to body fluids and after glove removal. So there's a lot of hand hygiene, right? That's the moral of the story is, like I said, we just gotta wash your hands all the time. You wash your hands more than you ever thought you ever would. Clean your hands after performing invasive procedures and using a tissue to wipe your nose or after you go to the washroom, please. This can help protect yourself and the healthcare environment from harmful patient organisms. We just don't know. We just don't know what's out there. We don't know what we're carrying, right? And we don't know what other people are carrying. And it doesn't have to be an infectious disease. It can just be something that you don't want to come in contact with, right? I'll tell you a very fast story about one of my infection control gurus who I respect highly. Her dad was a scientist, so she grew up in a lab, essentially. Like that was like playtime was go to the lab and play with stuff. So when she was a young girl, her and her dad took a bunch of swabs and they went to the hospital. The hospital. and they swabbed the elevator buttons. So there was 60% of the buttons had feces traces in them. I think it was 72 had urine. It's worse. 80, like it was around the 80 mark for semen, and over 90 for vaginal secretions. So traces of all of that found on those elevator buttons that we just touch and don't think about, right? Scary. So wash your hands. Contact with the room. So after. So now we're talking about after patient contact. So if you went into the room, you took them a glass of water, so you're going to wash your hands before you go in, and then you're going to wash your hands after. Any contact with equipment, and again, any contact with that wheelchair or stretcher, before and after. Clean your hands when leaving after touching any object or furniture in the patient's environment. Same thing, same moment. So moment 4, clean your hands after you leave your home care environment. So same thing, we do our hand hygiene in front of the client before we leave. And then sometimes when I get out to my car, I do it again. Especially if it was like a house that, you know, I didn't feel particularly clean in. I will do it again, just to be sure. And again, in contact with any treatment room on the way out. So on the way in, on the way out. So 4 moments of hand hygiene before initial patient or patient environment contact, before aseptic or clean procedures, after bodily fluid exposure, and after contact with patient or patient environment. We are going to watch this video, but we're going to watch it at the end in a few more slides, okay? Because I want to make sure it all goes smoothly. Now, performing hand hygiene. Proper technique is important when it comes to effective hand hygiene. Without proper hand hygiene technique, we can still spread many microorganisms with our hands. This section will cover the proper techniques for the following methods. So alcohol-based hand rub, soap and water, and without water when hands are soiled. So again, we're gonna watch all these videos at the end, okay? Alcohol-based hand rub is the recommended method of hand hygiene in any healthcare setting when hands are not visibly soiled, okay? So you look at your hands and they look clean, use alcohol-based hand rub. If you look at your hands and you see a little bit of blood or a little bit of stool or a little bit of your lunch, we need to wash our hands with soap and water, okay? Because the alcohol-based hand rub is not made to take off visibly that visible soiled product. You can wash your hands with soap and water and then use this if you'd like, but visibly soiled is the key to determine whether or not you're hand rubbing or hand washing. We put about a dime size amount into our hands and rub them together, palm to palm, fingertips on each hand. So we're gonna watch this video so it'll make a lot more sense. Fingertips should be going into the opposite palm to be scrubbed between and around fingers. Thumbs we do in the opposite hand, which again will make more sense once you see it, and the back of each hand with the opposite hand. Rub hands until they're dry before performing another task. So with the alcohol-based hand rub, it does need to be dry before we start doing something else. And we've all probably wiped it off because we were going to the mall and some of them are just like, oh my goodness, so much, right? And we're just, what do we do with all of this? But in the facility, the amounts should be predetermined. You know, you should be doing the right amount. Soap and water. So it's the same technique. Like I said, we're going to watch it. So this is 26. Soap and water is the recommended method. Again, when hands are visibly soiled. You see something on your hands, wash your hands. Plain soap is used for routine hand hygiene, while antimicrobial soap is used in acute care high-risk areas. You're going to have what you have, you know, depending on what facility you work at. If you have allergies, if you have something else, you need to tell your employer so they can provide you with the soap you need. I do have some staff members at the place I work that bring in their own soap because they just feel more comfortable using it, or they have skin conditions or whatever. So, again, again, this is going to make a lot more sense when you see it. It's a lot easier to absorb once you're seeing it. So wet your hands under the warm running water, put on the soap, distribute it over your hands. Rub your hands together vigorously to create a good lather, palm to palm. Rub the fingertips of each hand in the opposite palm, between and around fingers. Rub each thumb collapsed in the opposite hand. This is all the same, right, as the alcohol-based hand rub. Rub the back of each hand with the opposite palm. 30 seconds for good hand hygiene. Rinse hands thoroughly under warm water, warm running water. Pat hands dry with a paper towel and turn off the faucet with a paper towel. Ideally, we're going to open the door with the paper towel as well, so that we don't touch a door with our clean hands. It will make more sense when you see it on video. Okay, so what happens if you find yourself with soiled hands and no running water? So when access to hand washing facilities is limited and running water is unavailable, use a moist towelette if they have them to remove the visible stuff. Then do your hand hygiene with your alcohol-based hand rub. Sometimes we have to be a little bit creative based on where we are, but generally, like, this is not a regular problem you're going to run into. But this is what you would do: towelette first, and then alcohol hand rub. Same exact. Should be remove visible sweat. So you're gonna open your towelette and get the dirt or whatever is off your hands, and then you're gonna go into your hand rub. So same thing, palm to palm, fingertips, around the fingers, thumbs, back of the hand, right? So it just starts out differently. The rest is all the same. Artificial nails, gel nails, or extenders pose a risk to patients. So I believe the WRHA is 1/4 of an inch long. Your nails are allowed to be. Once you get out working in the field, you will not want to have nails. I promise you that. I have tried over the years where I'm like, I have an office, maybe sometimes I have an office job, right? And I'm like, I'm gonna get nails. No, gross. It hurts the clients. Definitely an infection risk, though. Definitely. Contaminated surfaces or objects should not be touched after performing hand hygiene. Avoid touching your face, especially your eyes and nose. And like I said, I'm a face toucher. If your clinical instructor says change your mask, don't take it personally, right? You probably just touched your face and you don't even realize it, because we do it all the time. Oh yeah, 1/4 inch right there. So fingernails should be kept short, no longer than a 1/4 inch or 0.632 centimeters long. You can wear nail polish in the WRHA, but it has to be removed the second it is chipped. So as soon as you get a chip in your nail polish, it's all got to come off. Because the chips are actually almost worse than the long nails for harboring microbes. Because it's like this jagged little area, and they like to hide in there, right? And then we touch our face, we touch our hair, we touch our nose, and now we've just spread something around. Do not top up a partially used hand hygiene product dispenser. So there are people that are responsible for keeping those full. Let them do it, right? The only time we ever did stuff like that, kind of, was in the beginning, again, of COVID, when everyone was panicking that we were going to run out. So we were doing some sketchy stuff with the hand sanitizer. If reusable dispensers are used, they must be emptied, washed, and dried prior to being refilled. Again, not your responsibility, but definitely tell somebody if something's running low. Hand lotion bottles must not be reused as well. Include frequently missed areas when performing hand hygiene, such as your thumbs, wrists, under the nails, and the sides of the hand. So we're pretty good at washing the palms of our hand, and we're pretty good at washing the backs of our hands. It's those other areas they just mentioned: thumbs, wrists, under the nails, and the sides of our hands. Those are the areas we miss the most, so take extra care there. Some places will have lotion. It's not the best lotion, but it's compatible with the type of alcohol sanitizer that they're providing. So it may not be something you would prefer or something you would, use at home, but it is what they supply and it is compatible. The problem with bringing your own lotions and stuff is that we don't know what's really, we don't know what kind of reaction your skin's gonna have when we start combining alcohol rub and your lotion and your gloves, right? And we don't want to have any painful hands. Wearing hand and wrist jewelry is not recommended as it prevents complete hand hygiene. So I have never, ever worn my wedding rings one single day of my life to work. I can't do it. I can't do it. So I have a wedding band, and I've actually never worn that to work either, even though I was like, if you give me a wedding band, I'll wear that. I don't wear any jewelry at all. Sometimes little earrings, but that's it. Because I don't want to spread things around with my jewelry. Thank you. So you have completed the module. 4 moments before initial patient or patient contact. Let's try that again. Before initial patient or patient environment contact, before any aseptic or clean procedure, after bodily fluid exposure, and after contact with patient or patient environment. And I would even go as far as to write yourself a cheat sheet on this one, because this is a question that comes up, like, say if you are working or you're a student and like standards come, or the people who like accredit your building, this is like a question they will 100% ask you. So don't be shy. Some places have little cheat cards that you can wear with your name tag, which is also very handy with the 4 moments of hand hygiene. The answers will be everywhere in your building, so make sure you know these 4 answers all the time. So just give me a moment. I'm gonna go away and get these videos set up, and then I will be right back.
Good job, baby. Good job. Raven, good job. Raven. Raven. Good job. Last one. Ayoko na. Tamis.
Okay, so the first video is like a very short video on the 4 moments of hand hygiene. The second video is somebody washing their hands. So the second video is basically what I need from you to hand in to me. If you do the things she does in this video, then you'll be fine. Okay, so let's take a look, and then you can let me know if you have any questions after. Just give me a minute to pull them up. So that's a much easier way for me to remember it, right? So before they went into the room, or before they had patient contact, before performing that technique of they give them a needle and they emptied his catheter bag, and then after patient contact and after they left the room. Okay? It's simplified. Definitely simplified. Okay, next one's a little longer, but not much.
Hi everyone. I wanted to demonstrate a hand washing technique. I tried to look for a video online and just couldn't find one that quite covered all of the steps that we would like to see all of our healthcare providers perform when doing hand hygiene with soap and water. So, very first thing we want to make sure in our environment that we have some soap and that we have some paper towel available to dry our hands. And then, of course, depending on the tap types, this one that I have has a hot and a cold, so you gotta just adjust your water accordingly. So first we start by turning on the water. And what we're going to do is we're going to wet our hands first. Now you notice that I took off any of my hand jewelry, including my wristwatch. That's because we can't really perform hand hygiene adequately with any kind of hand jewelry on or wristwatch. So I took enough soap in my hand to make a lather, and I'm keeping my fingertips down because first of all, if I put my hands up, everything's going to drip back into my sleeve, which is terrible. The next thing that I'm going to do, now some of you are probably thinking, oh, the water's running and should we leave it running? If you don't want the water to run, you can turn it off, but you're going to have to turn it back on to rinse your hands. All right. So again, going back, I want to keep my fingertips down because everything that is, first of all, not running down my arm, but also, relatively speaking, the fingertips are the dirtiest part of the hand. And so if the fingertips are the dirtiest part of the hand, and this is cleaner in comparison, we want everything to run from cleanest to dirtiest. We don't want to have the dirty run back into our clean hands. All right, so we start first by making a lather between our palms, and then we start covering all the surfaces, the back of the hand, the side of the hand, the thumb, the other thumb. So when we're doing hand washing with soap and water, we want to try and do it for at least 30 seconds, 20 to 30 seconds. Best way to do that is to count or to sing happy birthday in your head 2 times. Happy birthday to me, happy birthday to me, happy birthday dear Shelley, happy birthday to me, happy birthday to me, happy birthday to me, happy birthday dear Shelley, happy birthday to me. Now that should be long enough. And you notice I've covered every surface of my hand, including the tips of my fingers, along the sides, the thumbs, the wrists. The wrists, thumbs, and side of the hand, they're the common areas that get missed. All right, with rinsing, we're going to rinse one hand at a time, including the wrist. Then we're going to do the other one. And then we're going to take our paper towel, and we're going to pat dry our hands off. And then don't throw away that paper towel. We're going to use that paper towel to turn off our taps. Because if we used our hands to turn off our taps, our clean hands, we would contaminate our hands again by doing that. That's the same with touching the paper towel dispenser. That's why you make sure that your paper towel is up and ready for you for when it's time to dry your hands. Then we dispose of the paper towel in the wastebasket. And it's that simple.
Electrify your metabolism back to teenage levels by eating one after.
Okay, so that's what your hand hygiene video should look like. Maybe a little less in depth than that because she was talking a lot throughout it. So you can talk, you don't have to talk. It's totally up to you. What I'm going to do right now is take a look at your hand hygiene quiz, so I can give you a little idea of what that looks like. Okay, So just give me like less than 5 minutes. Okay, so oh, sorry. Oh, my computer's angry. Okay, there we go. It is, you have 20 minutes to write it. 15 questions, all multiple choice or true or false. I spelled midnight wrong. Oh. Okay, so it's due Friday at midnight. It is 15 questions, multiple choice, and true or false. You have 20 minutes to write it. It is due Friday. Okay. I have fairly strong faith that you guys could probably write it right now and be fine. That's totally up to you. Okay. If you were just paying attention. If you're listening to the last little bit of me talking, then you can probably write it right now. So it's open. You have between now and Friday to write it. Okay. Totally up to you. Now, there's other things and other labs and other things that are going to come up, right? So it's your responsibility to kind of keep track of when things are due. I will throw that that due date on it right away, so that it should send you a notification to remind you. But yeah, I think that's enough for today. Hey, that was a lot. Just taking a look at tomorrow. I think tomorrow we have a little more time just to work on things. So again, don't get too worried. Yeah, like tomorrow is a working day, basically. We have to do our lab PPE PowerPoints, which sorry, I'm just reading. It's opening. It's taking a little while. So we have like 10 slides tomorrow, that's it, to look at for PPE. So tomorrow will be a good day to kind of get caught up and to do your lab quizzes, right? So don't panic if you don't have time to do it today. Don't rush if you don't have time to do it today. We definitely have time tomorrow. So tomorrow will be a catch up and breathe day. Okay? So we're good. We can say goodbye for now, and I'll see you guys tomorrow morning. I ask that you stay online for like another half an hour for your attendance. I will be online tonight if you have any questions, and yeah, tomorrow will be more relaxed. Okay? Have a good night, everybody. Take care. See you soon.
struggles with nursing school.
I struggled throughout nearly.
Hey everyone, it's Sarah, the registered nurse RN. Ways a nurse can perform hand hygiene before and after patient care, after the wound, or touching something close, or after use soap, after exposure to bacillus, or eat soap. You need some paper towels and you need running water. Now faucets vary depending on where you are, or it has it all. Now generally it's best not to wear in some areas from wearing jewelry on. So if you do band on, it can harbor water to be warm, not too hot, because that can be helpful for you. So make sure it's warm because it's very dirty and you'll become contaminated. So once your water is warm, you want to put your hands lower than